Cornerstone Care provides primary care, dental, vision, podiatric, and behavioral services to patients regardless of ability to pay. Community health centers are located in medically underserved areas. The past year and a half has been tough, to say the least, has been tough. But if anything, it has reinforced the importance of community health centers such as Cornerstone Care in areas where we are located. The board of directors and staff are proud of our mission and the difference that we make in the areas that we serve. So thank you all for supporting our work. For the staff, thank you all for the work that you have done always, but particularly over the past year and a half. It certainly makes a difference. We know it has been tough, and we hope that you feel supported in the work and the mission that you are seeing very up close and personal on a daily basis. The board does represent the area in which we serve, and I'd like to introduce to you a couple of the other board members, all of the other board members that are here. That made it sound like I was going to pick and choose. Luigi Long, Victor Bell, Victor's our past board chair, Mike Gomber, and I think that's all the ones I saw. We've been meeting virtually for the last year and a half as well, and some of these faces I only know by a phone number on the screen, and some of them we have seen by faces, and of course everybody looks different with a mask on. So I thank the board for their service as well. We have tried hard to do the right thing during the past year and a half and always. So we appreciate all of your support, the legislative support that is here, whether that be at the local, county, or state level. We do appreciate that a lot, and we'll be introducing some of those folks here in a moment. I would like now to introduce our leader. Richard Reinhardt is the CEO, and I am pleased to bring Rich forward now.
You can learn a lot about community health centers a couple ways, certainly by going to Cornerstone Care's website, but I would also urge you to visit the website of our National Association of Community Health Centers. That is NACHC.org. I think that information is probably in your packets. Our national theme this year for the Health Center Week is Community Health Centers, the Chemistry for Strong Communities. And, you know, chemistry is a good word, but I call it what we do here in southwestern Pennsylvania, and that is good old-fashioned working together. I think we have been pretty, I won't say unique, but we have been at the front of the pack from what I can hear or understand from across the state and the country. We have been in that echelon where the community has pulled together, and that's the health systems and Washington Health System, and we partner with the Mon Health System in West Virginia, the county commissioners. It really takes all of us to do this, and the support from our public officials and our legislators, I just can't thank you enough. You know, this facility right here behind us, this where we meet today, and one of the reasons that we're meeting is because I have a little bit more space here, and in case there was going to be inclement weather, we could have gone inside. But this, we were just talking, realized that we just passed we opened this 10 years ago, just about today. I think it was August 11th or 12th. Right. And this is a very good example of how we collaborate and get things done. This was a coming together of the boards of directors of two health center organizations. It was Cornerstone Care, and it was the Mount Morris Primary Health Clinic at the time. Help me, Sarah. Primary Health Center at the time, and also a private dentist practice. Greg Montgomery is here with us today. Dr. Montgomery was private practice here in Mount Morris, and a private family practice. That was Dr. Miner. He has retired since. And probably forgetting something, but but there was a coming together of all these entities, and we formed, and we were able to build this building. A lot of support from federal grant, some state grant money, our own local investments, and this is. I'd urge you to take a tour of this after the program here. The thing that, and you're going to hear a little bit about it today, is the other addition was a pretty unique thing. I think it's a kind of best kept secret in our little corner of Pennsylvania here, and that is a teaching health center. We have one of the few teaching health centers across the country where doctors coming out of medical school are finishing up their formal education through graduate medical education program that we call the Teaching Health Center. And the unique part about that is it's based in a community setting, and not that there's anything wrong with a hospital setting, but it is unique in that sense. So you'll hear more about that. I am really honored to be a part of our mission, and so grateful for all of you, as I say, and the support that you have provided. The thought has crossed my mind that if, certainly in these times especially, that if community health centers did not exist, there would be some blue ribbon committee or task force somewhere talking about that right now and kind of inventing them. So I'm grateful to be part of this. We have just passed just a few days ago, Cornerstone Care passed its 43rd year of serving communities. We started in the little town of Greensboro, and I was just telling Betsy this morning that the first patient that was seen was in an old Victorian house, and that patient was seen by a nurse practitioner who lived in Greensboro by the name of Lydia Aston. And now we've come to the point where we have 14 centers and so forth. Cornerstone Care, as Karen says, provides health care to about 21,000 patients a year. When you look at one of our sister organizations, Centerville Clinic, many of you are familiar with them, in just sort of the southern part, I guess, of the southwest Pennsylvania area. Together, we're seeing over 60,000 patients. The 9 community health centers that are in southwestern Pennsylvania together see over 100,000 patients a year. In Pennsylvania, the community health centers across Pennsylvania are seeing about 1 million. That's about 1 out of 12 Pennsylvanians. And across the country, it's over 30 million. So our reach is pretty big. We still have a lot of work to do. I'm very proud of our teams here this year and really all times. I mean, we continue to get better, and we're dedicated to getting better all the time. Our team consists of about 200 folks, of healthcare providers, support teams, administrators, and so forth. They're all local people. They work at our 14 offices and in the field with our mobile units and our outreach efforts. And I like to think that we're part of this whole workforce across the country. It's about 250,000 people that are like the folks that work here at Mount Morris. And they're working at 1,400, it actually over 14,000 locations like this that are managed by about 1,400 individual independent community health center organizations. So I just cannot express how proud I am. Just honored to be a part of this, and it is my privilege here to introduce just a few of our dedicated leaders to share some of our success with you. And we will start with Sarah Carlo, who is our Director of Clinical Operations.
Every time Rich chokes up, I choke up. So sorry about that. And my colleagues will tell you I'm one of the most emotional people at Cornerstone. So, as Rich said, my name's Sarah Carlo. I'm the Director of Clinical Operations here at Cornerstone Care. I have worked at Cornerstone in various roles for the past 21 years. And my fellow colleagues will hear me say I started here when I was 10 years old. So, so I'm here just to talk a little bit about my role, and particularly my role over the past 18 months and some of the successes and the journey that we've had here at Cornerstone during the COVID-19 pandemic. My role is really to oversee our 14 locations and really make sure that our operations align with our mission, providing quality health care to our patients, regardless of their ability to pay, and also just making sure that we're keeping our services consistent and efficient in our facilities. But about 18 months ago, as we all know, the world changed, and so my role took on another identity. So we've heard a lot of people refer to people working in healthcare as heroes, and I can certainly attest to that. But more importantly, our staff came in every day and did their jobs. In the face of a deadly pandemic, despite fear and anxiety, despite times of staff shortages, our staff came together, they worked as a team, and they were all there for our patients. And that's really why we all entered healthcare in the first place, to help keep our communities healthy and safe. Obviously, there's a lot of attention recently on the vaccine efforts across the country, and for good reason. I'm proud to say that Cornerstone Care has administered over 15,000 vaccines over the course of the last 7 months. But every effort seems to have been overshadowed by the last during this pandemic. So it's sometimes easy to forget the foundation we laid prior to that vaccine effort. In March of 2020, we formed a clinical task force that was tasked with developing and redesigning policies and procedures surrounding infection control, enhanced patient and employee safety. In those early days, we would sometimes draft a policy in the morning and change that policy in the afternoon, according to what the Department of Health was advising us to do. Later, we started to lay the groundwork for the COVID testing efforts, our telehealth programs, and our vaccine distribution. Our staff and providers' agility during the last 18 months has been remarkable. They've been patient and responsive while we've updated and changed our policies. We enhanced, as I said, our procedures. We redesigned workflows in our offices. We implemented new technologies. We found new ways to communicate internally and externally, and developed creative ways to connect with our patients. I'm incredibly proud of the work that our administration and our provider leaders have done to make sure we created a safe environment for our patients and our staff. And lastly, I want to recognize the partnerships we've formed with our local health systems, as Rich mentioned, our local officials, area school districts, area businesses. Early on when testing was limited, and then later when we were forming our regional vaccine initiatives, we came together to address the needs in our area. So again, I welcome you to ask any questions. I didn't want to get into too much detail about what we've done over the past 18 months because it has been a lot. But I want to thank everybody for coming together and helping us celebrate our staff, our patients, our leaders. Community health centers had an opportunity to shine this past year, but we'd like to say that this has always been our mission and our story. So thank you.
So our quality department has come a long way in the last 10 to 12 years. Under the leadership of Rich as COO for many years, and now as the CEO. And like Rich said, just 2 years ago, we won a silver award from HRSA, and that was for our good quality measures. But our focus, and my focus, is the patient. So I'm always checking with everybody. So we're trying to make sure that our patients are getting their annual checkups, that they're getting their chronic care visits. So if they have hypertension or diabetes, they're coming in on a routine basis. Medicare wellness visits are required now. They need to be coming in for those. And all the routine preventative screenings. That's the things I focus on. We have caring, efficient providers And our care teams have become very engaged. In the past, I've been with Cornerstone a long time, so in the past, the providers did everything. And the MAs put them in a room and took their blood pressure and left and went and got the next patient. It's not like that anymore. Our support staff have taken ownership of some of the routine screenings. So they're getting the patient ready. They're doing depression screenings. They're ordering tests. They work off a standing order, so they can accomplish a lot before that provider gets in the room. So my thing is, it's a team. I'm always preaching team. I put it on my emails, team. That's how we get things done. Our MAs are even trained to discuss colorectal cancer screenings and diabetic eye exams with patients. And you can tell somebody once a year that they need that, but not everybody wants to go the first time they're told, and we tell them every time. So we take every opportunity to tell patients when they're due for the routine yearly screenings that we can. We also have integrated care coordinators. They help patients work with barriers to their care and meeting their medical goals, and they're also our link between behavioral health and social services. Even our front desk and our medical assistants, they work lists, they call patients, everybody, the whole team, from the front to the back, is the team who takes care of the patient, and that's the way that it should be. So it's never one and done. We take every opportunity when patients come in to make sure that they're getting what they need. And I am proud to say that I work for Cornerstone Care. I started at the front desk over 30 years ago, and I felt like I had a true connection with the patients at that time. Kind of miss it, but now I have that connection with the care teams. They're the ones who have the true connection with the patients. And some of those girls are pretty darn good. They can talk patients into stuff. They might know, I've told this person the last 10 times they've been here that they need this done. Today I'm going to crack it. We have team meetings and we talk about it, and the stories you hear are surprising, but they're getting really good at talking people into getting what they need. So at the end of the day, it's all about the patient. They're our focus, and we will continue to keep that patient-centered care moving forward into the future. Thank you.
And I just want to talk a little bit about our outreach programs. Our outreach programs embody the mission of Cornerstone Care to improve the health of the communities we serve. And our mobile services, we have a mobile dental program that provides preventative dental care to our Head Start programs, our school districts, and our child care centers, as well as other community locations throughout the southwestern Pennsylvania area. We have mobile medical services that provide family planning and family practice services throughout southwestern Pennsylvania and 7 counties in West Virginia, with school-based healthcare programs and education programs. The Smile for Life Oral Health Education Program is in all schools in Greene County, Fayette County, and many schools in Washington. So we're really trying to address the oral health care needs of our children. We have teen programs, the Teen Outreach Program in Fayette County schools, a health resource center in Fayette County schools, and most recently we received a 4-year federal HRSA outreach programs grant to start a program in Greene County that addresses overweight and obesity, diabetes for children in our school districts. We're partnered with all 5 school districts, Washington Health Systems, and the local Head Start program for that. In addition, we have about 7 licensed licensed health insurance enrollment assisters who visit our locations throughout the community and are able to provide assistance enrolling people through Penny, our statewide health insurance marketplace, or MAUD, CHIP, Medicaid, whatever they may need assistance with. We have assistance available for them. And we also have our wonderful community health workers who are working in the community every day, addressing social determinants of health. We partner with many local organizations, with all of our school districts, and in doing that, we really want to identify the healthcare needs of our community and target our outreach programs to meet those needs. And so I invite you this afternoon to visit our Toward Health Center, to our Teaching Health Center, and we have information tables set up that we would like you to stop and visit and talk to our outreach personnel and some of our providers and learn more about our programs and services at Cornerstone Care. Thank you so much.
Good morning. Katie told me that we were going to keep these introductions short and sweet, and I said no problem. So I'm Amber Warren. I'm the family medicine physician here at the Mount Morris location, and I am the Teaching Health Center director here. I'm actually from West Virginia. I'm from southern West Virginia, born and raised, and I came here in 2013. Right out of residency training and started here, and then in 2016 I became the program director for the Teaching Health Center. So for those who aren't familiar with Teaching Health Centers, they are they're residency programs, and it was created in 2011, I believe, under the Affordable Care Act to help put training programs into rural communities to address the health profession shortage areas. And so we have been training family medicine residents. We interview them as medical students, and then they come here for 3 years, and we have a total of 12. There are 4 in each class, so each year we produce 4 family medicine residents, and they go on to practice. Majority of them, we do achieve our goal of putting doctors into rural communities. They do mostly go to rural communities and practice, and we've had several stay in the area as well. So if you have any questions about the Teaching Health Center, feel free to grab me afterwards. Okay, thanks.
You thought he had to turn it up. That's hilarious. Thank you. Everybody knows I got a big one. Good morning, and what a glorious day. I thought it was going to be sizzling out here, but this is ideal. What a perfect day, and a perfect opportunity for us to really glorify this blessing that's right here in our midst. I always talk to people when I introduce myself from a podium. State Senator Cameron Bartolotta. I represent the 46th Senatorial District, which is Greene County, all of Washington County except for a little tiny bit, and 6 municipalities up in Beaver County. So from Aliquippa to the arms of West Virginia, and I always call it the cornerstone of the Keystone State, because it really is rock solid. There's nothing like southwestern Pennsylvania. And to tie in the name Cornerstone, it truly is the cornerstone of the community. And to hear everyone who has spoken so far, Richard and Sarah and Kathy and everyone, talking about how community comes together, that truly is the magic of southwestern Pennsylvania. People care about their neighbors. They care about their communities. And to hear Kathy talk about how, we're talking them into coming in. We're roping them in. We're doing it. And you know what? That's so vital. And then the outreach, too, Don, you're talking about going to with the kids. You got to start early. You got to teach these young people that it is so much easier to stay well than to get well. And going to the doctor isn't a scary thing. It's a good thing. And if you're lucky enough to be able to do it like we are in America, it's really, truly a blessing to do that and to live a long and healthy life. But just to say a few things about what we're doing here today. Community health centers play an integral role in our communities. Not only do they provide a comprehensive and convenient approach to meet the full spectrum of patient needs, but they truly act as care partners. Cornerstone Care community health centers live out their mission to improve the health of their patients with a special concern for the underserved. The health centers eliminate a barrier to care by substantially lowering medical and dental costs through a sliding fee program, and no one is ever turned away from service. That is huge. That is huge. Their care model is more about providing services to those in need than operating purely from a financially driven perspective. The men and women who provide critical care to others are dedicated to providing high-quality health care and support, both in moments of pain and moments of triumph. I would like to thank these compassionate frontline providers, particularly as they heroically served their communities even during a global pandemic. They genuinely deserve our sincere gratitude for their unfailing dedication during a public health crisis of a magnitude we have never experienced in our lifetimes. And now COVID has more updates than the iPhone. So during National Community Health Care Week, I would like to recognize Cornerstone Care and other community health centers and all the caring people who work here for all the advancements that they've made for the health of communities all across the state and our country. Thank you so much for what you do, and I will continue to be as supportive as I possibly can in my position as state senator, and I know that all of our wonderful elected officials feel the same way. And I'm sure that Nate, who's here to represent Pam Snyder, will tell you, God bless her, she's at the funeral for a hero for the working man, Richard Trumka. And I was there yesterday, so we're playing a little tag team. But thank you for being here, and thank you for including me, and thank you for doing what you do.